Do you know what is hypoxia? Well, indeed, I'm going to tell you. Hypoxia is a condition where a body or a particular tissue is starved of oxygen. This can happen due to a variety of reasons, such as high altitude, lung disease, heart conditions, carbon monoxide poisoning, and many other causes. When the body and tissue is lacking oxygen, it can lead to a variety of symptoms such as shortness of breath, confusion, dizziness, blue and pale skin, and even loss of consciousness. And left untreated, hypoxia can lead to a serious complications, including the brain damage and even death. Treatment can vary depending on the cause of the hypoxia, but generally involve increasing the oxygen to the affected area. And there are four types of hypoxia. The first one is hypoxic hypoxia. This is caused by the insufficient supply of oxygen to the lungs, such as high altitude. And the second one is anemic hypoxia. This is caused by the decrease of the amount of oxygen carrying by the hemoglobin in the blood, such as in case of anemia. The third one is circulatory hypoxia. This is caused by the decreased blood flow to the tissues, such as in case of heart failure or shock. And the fourth one is the histotoxic hypoxia. This is caused by the inability of the tissue to utilize oxygen, such as in case of drug overdose. The treatment of hypoxia depends on the underlying cause. For example, treatment may involve oxygen therapy, such as hyperbaric oxygen chamber, and medications or surgery. In case of altitude sickness, descending to a lower altitude is often the best treatment. If you suspect you or someone else is experiencing hypoxia, it's important to seek medication attention as soon as possible. Hypoxia can occur gradually or suddenly. Gradual onset hypoxia often causes less severe symptoms, allowing the body to adapt to a lower oxygen level. Sudden onset hypoxia, on the other hand, can be more dangerous or may require immediate attention. Altitude sickness is a common form of hypoxia seen in the people who rapidly ascend to high altitude. This form of hypoxia can be prevented by slowly ascending to higher altitudes and allowing the body time to adapt to the lower oxygen levels. Other forms of hypoxia can be caused by the chronic lung disease such as emphysema and chronic bronchitis. Hypoxia can be also caused by carbon monoxide poisoning. Carbon monoxide is a colorless, odorless gas that can be produced by gas furnaces, portable heaters, or generators. Hypoxia can have significant effect on the brain, including memory problems, difficulty concentrating, and even seizures. Prevention measures for hypoxia include avoiding situations that could lead to oxygen deprivation, maintaining good lung health, and avoiding situations where carbon monoxide exposure is likely. Hypoxia is a serious medical condition that can have very serious consequences. It's important to seek medical attention if you or someone else you know is experiencing the symptoms of hypoxia, as prompt treatment can often improve the outcomes. Hypoxia is often diagnosed through a physical examination and medical history, as well as through tests that measure oxygen level in the blood. In severe cases of hypoxia, supplemental oxygen may be required. This can be done through a variety of methods, including oxygen tanks, oxygen concentrators, and ventilators. In some cases, the treatment of the underlying medical condition causing hypoxia may be required. For example, someone with lung disease may require medications to improve lung function. High altitude climbers and aviators often carry a portable oxygen system to prevent hypoxia. Hypoxia can also occur in newborns who are born prematurely and have a certain congenital heart defects. People with certain professions such as firefighters and sea diving or deep sea diving may be a greater risk for hypoxia due to the nature of their work. Symptoms of hypoxia can sometimes mimic other health conditions such as anxiety or panic attacks, so it's important to seek medical attention to rule out other potential causes. Chronic hypoxia can lead to a variety of health complications, including heart failure, pulmonary hypertension, and cognitive impairments. Hypoxia can also affect the eyes, leading to blurry vision, loss of the color vision, and even blindness in severe cases. You can also do the hyperbaric oxygen therapy. Is a medical treatment that involves breathing pure oxygen in a pressurized chamber. It can be used to treat a variety of medical conditions, including hypoxia.